Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant non-stop show 1095th episode. Let's have the headlines of the day. An estimated 27.5 million couples in India are currently grappling with infertility, according to a recent study by the Indian Society of Assisted Reproduction. A new review by researchers from Oxford Population Health and the University of Iceland, published in Nature Aging, reveals how your DNA shapes reproductive health, fertility, and even life expectancy. Over the recent years, India has seen a huge rise in number of assisted reproductive technology clinics, making in vitro fertilization, that is IVF, and other fertility treatments more cost effective and easily available to the general population. The success rates of IVF treatments in India are approximately 40 to 45% under the age of 35 and approximately 30 to 35% under the age of 35 to 37. A recent McKinsey report on health tech innovations in India highlights the increasing adoption of AI in reproductive healthcare, where it assists in selecting high quality embryos, boosting IVF success rates by as much as 20 to 30%. Now, let's go to the topic of the day. So, today we will be talking about the future of genetic medicine. Uh, this topic is very close to our everybody's heart because it tells us why the infertility is increasing and how it is so important to be screened and exactly a personalized treatment made for every person. So to tell us about all of this is we have here Dr. Kamini A. Rao. She's Padma Shri Professor Dr. Kamini A. Rao, and she has so many degrees to her credit, starting from DGO, DORCP, MRCOG, DCH, FRCOG UK, MOBG UK, FICOG, PGDMLE Law, and FNAMS. DSC is another degree that she has to her credit, and she's a pioneering figure in the field of reproductive medicine in India. I would say in gynecology and obstetrics in India. She is the co-founder and chairperson of Medline Academics and co-founder and medical director of Dr. Kamini Rao Hospitals, a unit of Medline Academics Private Limited. She is recognized nationally and internationally, and she has been awarded the Padma Shri in 2014 for her distinguished contributions to reproductive medicine. She has received numerous honors and several lifetime achievement awards from esteemed organizations such as ISAR, Foxy, and the Times Health Excellence. A recipient of the honorary fellowship of the International Academy of Human Reproduction and a doctorate of science from Bangalore University, Dr. Rao has also represented India on the global stage as the first woman to serve as India's representative to FIGO. An acclaimed academic, she has authored over 52 medical textbooks, influencing generations of gynecologists and infertility specialists. I am one of those. So, welcome, ma'am. Welcome to our studio today. And shall we start, ma'am?
Thank you very much, Dr. Anita Kant. Our relationship goes back many, many decades.
Yes,
And
yes,
even though we've met many, many decades ago, it is almost like yesterday that I have
yes,
met
ma'am.
you. And that has been the relationship we've had. And considering that we have been in Foxy and at Faridabad as well, and also at various webinars, I must also, at this point of time, take a minute to remember Dr. K.K. Agarwal, and he
Yes,
was a great pioneer in the CME area. He always encouraged education. He always encouraged youngsters to get into the art of speaking and bringing CMEs across to inaccessible areas. And he felt that this was the need of the hour, that we had to bring education and also to the tier 2 and tier 3 cities. In fact, if Dr. K.K. Agrawal is known for something, it is for this education. And he has always had it very close to his heart. And I'm very happy that IGCP has taken this up. And Anita, I couldn't thank you more that I'm coming here on this platform. I missed it last week, but because of network connectivity, and I'm very happy to be here and to speak on this platform under Dr. K.K. Agrawal's umbrella. Thank you very much for inviting me, and we'll go on to the topic soon. Okay, fine. Shall
So,
I get slides?
uh, shall I start with the questions?
Yeah.
What are some common genetic conditions that can impact fertility or pregnancy outcomes?
See, when we talk of genetic conditions, it is such a big umbrella that one cannot actually pinpoint and say it can be this or that. Many of the genetic conditions are not even diagnosed when the woman actually presents to you in the clinic. We are talking genetic conditions means chromosomal conditions. Chromosomal conditions forms only a small part of the genetic conditions. Like, for example, if we talk chromosomal disorders, there are certain sex chromosomal disorders as well as. Now, you've heard of Down syndrome, then you've also heard of Turner syndrome. Then, of course, you have X-linked disorders, then you have monogenic disorders, then we have disorders like, for example, thalassemias, sickle cell anemias, then we've had hemophilias, Duchenne muscular dystrophies. But these are disorders that have already been identified in the individual and then they come to you. But the talk that I'm going to give of personalized medicine is how do you identify this before it has been identified in the individual? And that is where the personalized medicine comes in. If you are able to look at the gene and the genetic code of the individual, not only you will be able to look at that particular gene code of the individual, you will be able to personalize the individual's needs so that you would be able to look at what exactly is the cause of infertility in her rather than trial and error and do a whole battery of tests. Secondly, what will be the ideal dose of gonadotrophins you need to give? Is she allergic to any particular medications rather than she goes through an anaphylactic shock, near death experience, and then you write on that particular case note that she's allergic to sulfur, she's allergic to penicillin? No, but this can be identified by just a chip. Put a finger into that particular chip, and that will be able to read your whole genome sequencing. Now, this is something which I would say is what genetics is going to be in personalized medicine. So, if I were to get the slides put in, Anita, I'll be able to actually explain how this will actually work with infertility, because it will exactly change the way we look at infertility and what the cause that infertility is. This is not going to increase the cost of infertility, it will optimize the cost of infertility, and it will absolutely bullseye the cause, diagnosis, etc. Okay, so if we were to now look at this particular this thing, we'll go into the next this thing. Now, which what would be the scope here? We will be using artificial intelligence. Now, everyone knows that in every field, artificial intelligence is here to stay. Not that it's going to take the intelligence of the human being out, but this is going to add as an extra tool. So, artificial intelligence in genetic screening and personalized medicine in fertility treatments. So there is no more trial and error. So for everyone, you don't have to go and do FSH, LH, you don't have to do AMH. So you don't have to keep doing, a kind of run of the mill kind of things. It is going to be absolutely targeted. So if you're going to shoot somebody, you shoot only that person, don't shoot the community. So this is what personalized medicine is going to be, and technological innovations and future prospects. And then finally, what is the conclusion and vision for the future? All right. So if you're now going to do the next one, okay. Now the scope
Yes.
of my talk here would be looking at this particular this thing is what will it do? This genetic personalized screening. It will improve your precision. That means if you have 10 tests to do, it will tell you choose one. That's where it will bring down your cost. Algorithms analyzes extensive genetic data with great accuracy. That means if one person needs 300 units of gonadotrophins, it will be able to analyze whether this person actually needs 300 units or will 150 units suffice. So it will reduce the chances of OHSS. Then machine learning models which will detect the patterns and correlations in genetic sequencing. So a lot of cancellation of cycles will be reduced, and therefore you will be selecting the right kind of dosage for the right kind of person. And models learn and redefine continuously. It accelerates the screening process and delivers results in hours or days and very short turnaround times. So, if we are now going to look at the next one, how does artificial intelligence in genetic screening? See, accessibility and cost effectiveness. Any of the AI driven tools, for example, okay, can be deployed in various, even in remote areas. So, if you're looking at tier 2 cities or tier 3 cities, this can actually be done. So, with the help of remote sensing, this can actually reach those places. Genetic screening becomes more widely available. So you can map the genetic constitution of the population. So we will be able to have what constitutes the genetic population in one sect of that particular area. And it becomes lower cost and more affordable for the genetic testing to be done. Now, if you look at the coastal areas, you see that sickle cell anemia is much higher. But if you look at a certain sector of a population, thalassemia is higher. So then you can actually screen and then target that particular group to go in for more diagnostic tests. And that is what we need to be looking at, targeting the test. And the emerging technologies in genetic screening will be the next gen sequencing. It provides fast, accurate, and affordable test options and accessibility of genetic screening. Now, you may say, what is the use? Now, for example, if you are taking a donor case, and then you suddenly find that she is a thalassemia trait. Now, this particular test, just a single drop of blood, will be able to find whether she is a thalassemia trait or has she got a trait, a recessive trait for Duchenne muscular dystrophy, and she may never know because she may be just a carrier. And if you are using this kind of model algorithms, you will be able to actually eliminate these recessive traits and actually eliminate these kind of diseases from the face of the earth. And advanced technology makes genetic screening more accessible to a broader audience and widespread adoption in fertility clinics. This becomes the need of the hour. So, more the tests, the lesser the cost. So, its applications impacts the realm of precision medicine. Now, we are not here to say sab kuch chalega. Okay, we are here to look at it in a different way. How are we this thing? Precision medicine aims at tailor-made treatment by detailed insights into genetic variations. AI will support ensures improved patient outcomes. So, which means whether she is in a tier 3 city or tier 2 city, she will receive the best possible treatment that she would get in any metro or in any high tech corporate hospital, because AI will enable us to look at personalized medicine using algorithms, and therefore there is no need for her to come into corporate hospitals. And this is something which will actually be a game changer. The predictive analysis for this will be machine learning models and can analyze and predict the risk of developing any kind of certain diseases. For example, if you're looking at embryos, all right, and if there has been a chance of some kind of genetic disorders, the predictive value of these kind of genetic screenings, it will tell you the odds ratio of these embryos likely to, for example, develop diabetes at 40 years, develop hypertension at, say, for example, 25 years, looking at the family tree and the personalized medicine. It also enables implementation of preventive measures and early intervention. So, preventive medicine becomes the need of the hour. An ounce of prevention is worth a pound of cure. All right. So, we need to keep that in mind. So, how does drug development get benefited with artificial intelligence? It is genetic screening, which plays a vital role in drug development. And therefore, with pharmacogenomics, we have polytropin delta and gamma. That means longer acting. You don't have to take daily doses of the FSH. You can take one injection for 7 days. That means you don't have to keep coming to the hospital every day. And this can work for you for 7 days. And by understanding the genetic factors that influence drug response, more effective and personalized medicines can be developed. And you will also know which are these people that whatever drug or dosage of FSH you give or HMG you give, these people are not going to respond. And those are the ones that have polymorphism. Rather than having to give 2 cycles and 3 cycles of 450 units and then say, I'm sorry, I can't help you, pharmacogenomics with AI will tell you right in the beginning, don't give, because this lady is not going to respond because she has a receptor problem for FSH and HMG. Now, that is beautiful because this kind of preventive genomics would not have been possible had genetics not, moved this far. So, understanding the genetic factors that influence the drug response and more effective and personalized medications can be developed. So, therefore, those that have receptor polymorphism, you can have artificial intelligence to identify biomarkers that will indicate the patient's response to a particular drug. So now they are developing certain other drugs which can overcome the polymorphism, and those drugs will then be used as targeted therapies and therefore with fewer doses rather than any kind of trial and error. What about genetic counseling? Now, this becomes a very integrated part of personalized medicines. All AI tools support genetic counseling because of accurate and comprehensive genetic information, better guidance to patients regarding their genetic risks, implications for themselves and their families, and artificial intelligence can also help to interpret the data. Now, important is not to just have a lot of data before you and then hand it over to the patient, but how do you interpret the data and explain to the patient is also very important. Okay, but a very big question here: ethical considerations and challenges. Data privacy. So, are we going to look at the entire population and say we have now the genetic makeup of the entire population? So, if I were to do a biological warfare, then if I inject, then the entire population is going to go. This is what happened with the COVID, for example. It was a lab created virus, and this is what happened. So ethical considerations are as important as medical advances. So informed consent is important. Regulatory compliance and the integration of AI in genetic screening must also comply with regulatory standards and guidelines, needing to ensure safety and efficacy, and regulatory bodies needs to establish clear frameworks. Okay. Yeah. What will be the future directions? Emerging AI models will offer greater accuracy and efficiency, and that is a given thing. And the capabilities of this genetic screening will expand, no doubt. But collaboration between AI researchers, geneticists, healthcare providers is essential to harness the full potential of artificial intelligence. But the second challenge will be, how do you integrate other technologies as well? The integration of AI with genomics, bioinformatics, and wearable health devices will further enhance genetic screening. What do I mean by that? For example, if a person has a liver disease, now if they have something like a watch, a digital watch, which will be measuring their blood pressure, which will be measuring their serum bilirubin, for example, or which will be measuring their lipids, triglycerides, then they will have an inbuilt alarm system. And if they're going into some kind of liver failure, then this watch, wearable watch, will then be connected to a central system, digital system in the hospital, which will then get a signal to say that this person is going into some kind of a hepatic coma. So while the home care treatment is going on, the signals that will reach the ICU will tell us that this person has to be shifted into the ICU from home. So, therefore, the ICU beds will not be crowded, but only the ones that really need the treatment. So, these kind of wearable, gadgets will be able to help a lot of people at home care, so that these people will be at home but still be attached to the hospital. And this provides comprehensive health insights and enables continuous monitoring of these genetic risks. Okay. And the future directions of these health platforms will be AI driven, genetic screening, and be integrated into personalized health platforms and offer tailor made health recommendations and interventions much before the catastrophe happens. And this is what is very important, not when the catastrophe has happened. So, this is more preventive and therefore becomes less expensive. It empowers patients to take proactive rather than reactive steps in managing their health. And the global collaboration in AI and genetic screening research can accelerate this process and ensures that the benefits of AI are accessible worldwide. So, the strategic steps for future research and development would be to refine genetic screening, and this should be prioritized the improvement of genetic screening technologies, but ethical implications should not be forgotten, and exploring the ethical implications of genetic research is essential to address privacy, consent, and potential discrimination issues. So this kind of designer babies, blue eyes and golden hair, and these kind of things should not be actually looked into. And equity rather than equality in personalized medicine. And it involves making these technologies accessible to diverse populations and communities. And this becomes like affordable and accessible to all. And this is how the future should look, where everyone is able to afford this kind of medicine, which is cost effective, and it gives you targeted approach, and at the end of it you're able to eliminate a lot of genetic disorders which would have actually crept in because of ICSI, because many of these genetic disorders, if the ICSI was not there, they would have actually disappeared. But because we've had this ICSI coming in, and we are now creating a whole lot of recessive disorders that are actually showing their ugly head up, this personalized medicine and genomic screening, metabolomic screening, proteomic screening will make a big difference to the new gen population. Okay. So, in case studies and success stories, personalized medicine in fertility means significant improvements in success rates and better outcomes, satisfaction and betterment. Like Anita said, that you had a success rate of 45%, but now using these kind of precision medicine concepts, you could theoretically go almost up to 70 to 80%, because you have eliminated those kind of pitfalls that you would have not done had you not used personalized medicine. So, what are these? They are genomics. They have used the individual variability. They've used biomarkers, integrative approach using liquid biopsies, proteomics, microbiomes, and of course, genome sequencing, and of course, overarching ethical considerations. But it must be that patient satisfaction and betterment. Very, very important. Okay. Now, the impact on global fertility trends. Genetic screening is here to stay to improve fertility outcomes. Personalized medicine approach impacts quality of life. Global population dynamics impacts positively, and therefore you don't have to have differently abled children being brought into this world, because it impacts the community. It adds an extra burden to the government, so you can prevent it, and therefore this has to be used optimally. So, using this kind of trend, bringing in this kind of artificial intelligence and using it carefully, keeping ethics and legality in mind, and working within the four corners of law, I think the genetic screening impacting fertility is here to stay, and I hope that with this treatment, infertility will be by choice and not chance. Thank you very much. Long term benefits for individuals and society, increased accessibility, enhanced success rates, and reduced genetic disorders. So, to conclude, AI has a potential to revolutionize genetic screening with great accuracy, efficiency, and accessibility, and it will play an increasingly vital role in precision medicine, helping to identify genetic risks and to develop personalized treatments, and also not forgetting the ethical consideration, which is very crucial when we are dealing with life and quality of life. Okay, so we look for a day when we will be saying that infertility is by choice and not chance. Thank you very much. Thank you.
Then that was really, really an eye opener and amazing talk that you gave us. Thank you, Padma Shri Professor Dr. Kamini Rao, for joining us today. Could you show us the certificate, please?
Which certificate?
This is a small token of thanks from our side that you were here, you spent time with us, you told us so many new things, and I'm sure the viewers have loved it as I have too. And that will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Namaskar.